It's often referred to as the silent killer. Many times women with ovarian cancer have no symptoms or just mild ones until the disease is in its advanced stages. At Arizona Oncology, a large team of experts are helping women get through the treatment they need while providing them with a large dose of encouragement and hope to help make them through it.
Whenever you have cancer, you want a team of physicians to be involved in your care.
And that's why so many patients are turning to Arizona Oncology and doctors like Shana Wingo. Many of the women who Dr. Wingo treats have been diagnosed with ovarian cancer.
Ovarian cancer is a malignancy that affects the genital reproductive organs in women. So ovaries, uterus, and fallopian tubes are typically what we deal with GYN cancers.
While any woman is susceptible, Dr. Wingo says ovarian cancer usually strikes older women, and oftentimes the disease goes undetected.
The big issue with ovarian cancer is the symptoms tend to be relatively nonspecific, and so as such it is a diagnosis that is often missed or prolonged. So there's a lot of bowel symptoms, so GI symptoms, getting full fast when you're eating, having difficulty eating a lot of food, so feeling full very early, some diarrhea, constipation, abdominal pain, and certainly as the cancer is more advanced, it is lots of belly and abdominal swelling.
And unfortunately, there are no reliable screening tests.
There are no good tests. Ultrasound sometimes picks up masses, but it's not considered something that we screen for. There are blood tests that we check for ovarian cancer, but also something that is not useful as screening because those tests are abnormal for benign conditions, can be abnormal with benign conditions as well. The goal is not to panic about this. I always explain to my patients 1 in 8 women gets breast cancer, 1 in 70 get ovarian cancer.
For those women who are diagnosed, Arizona Oncology and the team of doctors are helping them through the difficult process.
Typically what happens with Arizona Oncology, we have 3 different broad categories of oncologists: GYN oncologists, medical oncologists, and radiation oncologists. So we like to take a team approach. Many cancers require a multifaceted approach to treatment. So you want to have all of your physicians and care providers collaborating on your behalf.
And with a partnership with U.S. Oncology Network, patients receive a high level of care.
U.S. Oncology is a network that Arizona Oncology is in. And with that, we have exposure to clinical trials that are given nationally in a wide variety of cancers. So it's useful when you're a part of a network to get that exposure to things that you may not have in a smaller facility.
With a facility dedicated to getting women's lives and health back on track, Dr. Wingo says it's her relationship she develops with these women that make her job so rewarding.
I think the individualized care that patients get, the family feeling you get when you come through the door, are a big and important part of your cancer care. But knowing that you are in a network that is much larger than the size of the office that you're visiting. I think whenever you are somebody that has dedicated your life to oncology, part of the beauty of women's cancer care is these patients stick with you forever. And you get to see their life and them live their lives. You meet their family members, you meet their grandchildren, and it's a family. This is a process that we live together, and it's the best thing that you can do as a physician.
If you would like more information about Arizona Oncology, you can visit their website, ArizonaOncology.com, or call the number you see right there on the screen.